Chapter 2, Family-Centered Community-Based Care. Upon completion of this chapter, you will be able to examine the major components and key elements of family-centered community health care, explain the reasons for the increased emphasis on community-based care, differentiate community-based nursing from nursing in acute care settings, integrate the different levels of prevention in community-based nursing, providing examples of each, cite examples of cultural issues that may be faced when providing community-based nursing, describe the dynamic forces contributing to cultural diversity to adapt delivery of culturally competent care to women and their families, construct strategies for integrating elements of alternative complementary therapies, identify the variety of settings where community-based care can be provided to women and their families, outline the various roles and functions assumed by the community health nurse, demonstrate the ability to use therapeutic communication skills when interacting with women and their families, evaluate the process of health teaching as it relates to women and their families, and finally determine the importance of discharge planning and case management in providing community-based care. Family-centered care. Family-centered care refers to the collaborative partnership among the individual, family, and caregivers that exists to determine goals, share information, offer support, and formulate plans for health care. It is generally understood to be an approach in which clients and their families are considered an integral component of the healthcare decision-making and delivery process. The types of support. Informational support is designed to provide supportive communication by making available understandable information to the family about their members' condition, treatment, development, and care, about their behavioral and emotional responses and needs, and about what to expect regarding their condition. Emotional support includes listening, exhibiting caring behaviors, and being concerned in ways that help the family cope with their members' illness and other aspects of their lives that are affected by the illness. Appraisal support, also called esteem support, is conceptualized as enhancing, reinforcing, and supporting the family role. Finally, instrumental support includes providing assistance of any kind, such as financial, time, labor, or environmental modifications. The philosophy of family-centered care recognizes the family as the constant. The health of all the family members and their functional abilities influence the health of the client and other members of the family. The core concepts of family-centered care include dignity and respect, sharing healthcare information, allowing patients and family to participate in care, and providing collaborative care for the client and the family. Community-based care. To talk about the community-based care, let's define community. Community is a group of people in defined geographical area who share common interests, interact with each other, and function collectively in a defined social structure to address common concerns. A person can be a part of many communities throughout their lifetime. Community is the unit of service, concern for clients as well as for the larger population of potential or at-risk clients. Community health nursing. Community health nursing focuses on prevention of illness and improvement of the health of populations and communities. It includes geographically and culturally diverse settings. It allows public health nurses to specialize in areas of community health nursing. It uses epidemiology to determine the health needs of populations and assists in planning services for those populations. And it uses Healthy People 2020 for national health initiatives to follow. Community-based nursing focuses on health promotion and primary health care. Settings include the ambulatory care centers, home health care, occupational health, school health, hospice, and many other settings. Clinical practice includes case management, research, quality improvement, and discharge planning. employment opportunities in staff development, program development, and community education. This is table 2.1 on page 41 in your book, and it just goes over the different types of community-based practice settings. Some community-based nursing interventions that nurses can be involved with in the community include health screenings and health fairs, health education programs, medication administration, telephone consultation, health system referral, instructional, nutritional counseling, and risk identification. And box 2.1 on page 42 in your textbook gives definitions of all these different nursing interventions. And so you can read that on your own. Home care and visitation planning. You want to review previous interventions to eliminate unsuccessful ones, basically using your nursing process. Prioritize clients' needs. Develop goals that reflect prevention of disease. You want to bear in mind the client's readiness to accept interventions, because if they're not ready to accept interventions, you're going to have to start all over again. Consider the timing of the visit. Outline nursing activities to be completed during the visit, and determine the effectiveness of the visit. So these are for nurses who are planning home care visitation. Now this is important, and I know you've heard this before, the different levels of prevention in community-based nursing. So we have 3 levels of prevention: primary, secondary, and tertiary. The concept of primary prevention involves preventing the disease or condition before it occurs through health promotion activities, environmental protection, and specific protection against disease or injury. Its focus is on health promotion to reduce the person's vulnerability to any illness by strengthening the person's capacity to withstand physical, emotional, and environmental stressors. Primary prevention encompasses a vast array of areas including nutrition, good hygiene, sanitation, immunizations, protection from ultraviolet rays, genetic counseling, bicycle helmets, handrails on bathtubs, drug education for school children, adequate shelter, smoking cessation, family planning, and the use of seat belts. Secondary prevention is the early detection and treatment of adverse health conditions. This level of prevention is aimed at halting the disease, thus shortening its duration and severity to get the person back to a normal state of functioning. Health screenings are the mainstay of secondary prevention. Pregnancy testing, blood pressure evaluations, cholesterol monitoring, fecal occult blood testing, breast exams, mammography screening, hearing and vision exams, and pap smears are examples of this level of prevention. Tertiary prevention is designed to reduce or limit the progression of a permanent, irreversible disease or disability. The purpose of tertiary prevention is to restore individuals to their maximum potential. Tertiary intervention takes place only if the condition results in permanent disability. Tertiary prevention measures are supportive and restorative. Question: is the following statement true or false? Health screenings are an important component of primary prevention. True or false? The answer is false. Health screenings are an important component of secondary prevention because they aid in the early detection of disease. Cultural competence. Cultural competence is the knowledge, willingness, and ability to adapt health care to enhance its acceptability to and effectiveness with clients from diverse cultures. And if you look at box 2.3 on page 46 in your textbook, it goes over the steps to developing cultural competence. So you have to be culturally aware, have knowledge of the culture, cultural skills, and the cultural encounter. Cultural competence is a dynamic, lifelong process. There are barriers that are related to providers and those related to the system. And you can read about that in your textbook. This is, again, what we just talked about, box 2.3, the steps to developing cultural competence. Now we'll talk a little bit about CAMs, which you guys probably have heard of. You've probably talked about them in your pharmacology classes. CAMs are complementary and alternative medicine. CAM is not specific to one particular ethnic or cultural group. It is definitely growing in popularity. 36% of adults and 12% of children use CAM therapy. Prayer is the most common form of CAM therapy, and CAM is being used increasingly by midwives for childbirth. Integrative medicine. Complementary medicine is used together with conventional medicine, such as using aromatherapy to reduce discomfort after surgery or to reduce pain through a procedure or through an early labor. Alternative medicine is used in place of conventional medicine, such as eating a special natural diet to control nausea and vomiting, or to treat cancer instead of undergoing surgery, chemotherapy, or radiation that has been recommended by a conventional doctor. Integrative medicine combines mainstream medical therapies and CAM, for which there is some scientific evidence of safety and effectiveness. Your integrative medicine focuses on treating the whole person, not just the disease. It involves treating the mind, body, and the spirit at the same time. We know it combines conventional Western medicine with complementary treatments, and nurses need to understand all aspects of CAM, including cost, client knowledge, and interactions that they may have with other drugs. This is table 2.2, and it's located on page 48 in your textbook, and it just goes over some of the complementary and alternative therapies. I know we use aromatherapy, we use a lot of lavender in OB, acupressure, puncture, reflexology, therapeutic touch, massage therapy, so you can just read through those. This slide just talks about the most commonly used CAM therapies during pregnancy, massage, acupuncture, acupressure, vitamins, and herbs. As a nurse, we need to educate and give instructions to clients using CAM therapies. We need to let the patient know, do not take for granted that the substance is beneficial or harmless. Seek medical care when ill. Inform your provider if you're taking any herbs or alternative therapies. Be sure that the package lists all the ingredients and amounts. We need to tell the patient to be aware that large doses of CAM preparation may be harmful. And then as patient advocates, we need to inform the patients to do their research, as well as we need to do our research on some of the different CAMs that our patients are using. This slide goes over the different types of settings for labor and birth. Really, there's three main. You can have a hospital birth, a birthing center, which is a home-like setting close to a hospital if complications arise. Usually, a lot of your midwives run their birthing centers, and if you are a low-risk patient, you can go to a midwife and deliver at a birthing center. Or you can deliver at home. Family-centered birth appropriate for women at low risk for complications. It's the least expensive. The only downfall, there is limited availability to pain medication, so there's no getting an epidural if you're trying to deliver at home. Question: is the following statement true or false? A home birth is typically advantageous for a woman because it allows her a variety of options for pain medications. True or false? Of course, the answer is false. We know that pain medication is limited with a home birth. This slide just talks about some of the community resources available to new mothers. They can have telephone consultations. Sometimes, depending on the hospital you deliver at, after you go home,
you've got a text message.
You can, the nurses may call to check on the patient. There's outpatient clinics, postpartum home visits by a community-based nurse. I know back when I was in school, we had Healthy Start, I think, and we had nurses that would actually go to the women's homes and make sure that they were doing okay after the birth and making sure that the baby was doing okay. I know it was part of our community clinical where we went around with the Healthy Start nurses. There's actually support groups for new mothers and high-risk newborn home care where we're taking care of the sicker babies at home. And this is just a picture showing that the mom is breastfeeding or attempting to breastfeed, showing that the baby is latching on. So, roles and functions of the community-based nurse. So, communicator. As a nurse, you have to be an effective communicator. You have to be able to communicate with your patient and their family, and you have to be effective. That builds trust with you and the patient. Direct care provider. The community-based nurse typically performs less direct physical care than the nurse in the acute care setting. Many times the nurse may observe the client or caregiver performing physical care tasks. So as the community-based nurse, you can actually see the direct care of how the mom is interacting with the baby, how the dad is interacting with the baby. In addition, the nurse provides direct care involving the following areas: contraception, abortion, infertility, screening for STIs, and preconceptual risk assessments and care. The community-based nurse is educator. Like we talked about earlier, the hospital stays are being shortened, and typically we do a lot of teaching in the postpartum unit, but a lot of the things that your women are going to experience is going to happen when they've been discharged and they're already home. So we do a lot of education, and this is where it's good to have a community-based nurse, because she could stop by and visit the patient who may be having problems with engorgement. Discharge planner and case manager. Again, because of the short length of stays in acute settings and the shift to community settings for clients with complex health needs, discharge planning and case management has become an important nursing role in the community. Definitely advocate and resource manager. If you are working in the community, you become kind of like the nurse / social worker, where you act as advocate for the client and you ensure that the client and family's needs are being met. So to go a little bit deeper in the different roles of the community health nurse, the nurse is communicator. You use verbal and nonverbal communication to communicate with your clients. There's differences when you're communicating with the deaf or hearing impaired client or working with the interpreter. I remember I had a client who was deaf, and she had an interpreter to do sign language, and it was so hard for me not to talk to the interpreter while, not to look at the interpreter while I was talking. And she always had to tell me, look at the client, talk to the client, don't talk to me. It was just strange, but eventually I got used to it. When communicating with families, you want to be honest. You want to help the families understand the long and short-term effects of therapy, and ensuring confidentiality and privacy, or, your HIPAA. The role of the nurse is educator. As a nurse, you're going to provide client and family education, assess their teaching and learning needs, plan the education, do interventions to enhance their learning, and document your teaching and their learning, and if they had an understanding of your teaching. Techniques to facilitate learning when you're out in the community, or even if you're in an acute care setting. Slow down and repeat information often. Speak in conversational style using plain language. You don't want to use your medical lingo with the layperson. Chunk your information and teach in small bits. Prioritize information teaching with survival skills addressed first. Use visuals such as pictures, videos, and models, and teach using interactive hands-on approach. We're up to another question. In the role as advocate, the nurse, A, coordinates healthcare services, B, provides atraumatic care, C, assesses health literacy, or D, ensures access to available resources. The answer is D, ensures access to available resources. I'll leave this here so you can read the rationale. All right, so role of the discharge planner and case manager. As the nurse who's in this role, you're going to develop and implement a comprehensive plan for the safe discharge of a client from a healthcare facility. You're going to ensure that there's continued safe and effective care in the community and home. You're going to coordinate healthcare services while balancing quality and cost outcomes. There's that word again, cost. And initiate and maintain the link between the team members and the client. This is the end of the audio lecture for Chapter 2. Thank you.